Welcome to the Board of Health meeting of November 17th, 2025. Please note this meeting is being recorded and will be available shortly hereafter for scheduled and on-demand viewing on any smartphone or tablet. If anyone else is recording this meeting, including the use of AI note-taking apps, please notify the chairman. Pursuant to Governor Healy's March 29th, 2023 signing of the Acts of 2023 extending certain COVID-19 measures adopted during the state of emergency, suspending certain provisions of the open meeting law until June 30th, 2027, this meeting of the Chatham Board of Health is being conducted in person and via remote participation. Every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. I'm reminded that persons who would like to listen to the meeting while in progress may do so by calling 508-945-4410. The conference ID is 203-07984#, or they may join the meeting online via Microsoft Teams through the link in the posted agenda. While this is a live broadcast and simulcast on Chatham TV, Xfinity Channel 1072, despite our best efforts, we may not be able to provide real-time access. We will post a record of this meeting on the town's website as soon as possible. I'll turn the meeting over to our chairman, Dr. Noble Hanson.
Thank you. It shall be the policy of this board to conduct its meetings under the open meetings laws so as to encourage public participation whenever time permits and as part of agenda item discussions. We have 2 items on the agenda today, but first let's establish a quorum, and when I call your names, please say present. Carol Boyce.
Present.
John Beckley.
Present.
Ron Broman.
Here.
Dick Edwards.
Here.
Our Noble Hanson here, and then our alternates, Ron Weiser.
Here.
Joanne Kalb.
Here.
Hale. Here. Okay, good. So first on the agenda is a variance hearing for Barbara Rybeck, 204 Insurance Trust, 22 Taylor Pond Road, Clark Engineering LLC, and David Clark is here to present the case for the variance.
Good afternoon, David Clark, Clark Engineering, on behalf of the Rybeck family. This is a project where they're demolishing an existing dwelling. The property has been in the family since the house was built, I think in the late 60s or early 70s. So they're demolishing the house, and they required to put in a new Title V system. It's been served by cesspools for 50-plus years.
Can you get a little closer to the mic for us?
Oh, sorry. So the new system, well, the resource areas that we had to deal with in conservation are primarily the coastal bank. And that is basically a coastal bank by definition, in that the landforms immediately adjacent to the existing house meet the criteria of a coastal bank, even though that landform was most likely man-made when the house was built. Nonetheless, it's a coastal bank under the regulations, and there is no place on the property to put the soil absorption system, the leach field, 100 feet from that, as required by Chatham's regulations. So in designing the house, we worked around having the septic system as far away from the bank as possible. So we've tucked it into that corner of the property. There's just no other place to put it. Regardless of the fact that we're tearing down the house and building a new house, the new house doesn't impact where the septic system can go. Like I said, we've tucked it into the corner of the property where it's the furthest from the coastal bank. We've been to conservation already and got approval, and we've gone to the zoning board of appeals and got approval. Again, the only variance that's required is that it's less than 100 feet from the coastal bank. We meet all the other requirements of Title V, and we meet all the other requirements of the local bylaw. One thing I want to point out that although this is a coastal bank, there's another house that's between this one and Taylor's Pond. So it really is a regulatory bank and not a coastal bank that provides any of the functions under the wetlands regulations. One other point, it's currently being used as a 6-bedroom house. There are 5 bedrooms that meet the criteria of Title V and the Board of Health regulations. There is a pass-through room on the second floor that is used as a bedroom. When I walked through the house, there were 2 sets of double beds in that room. So the new house is only going to be 4 bedrooms. So the number of bedrooms are being reduced as part of this redevelopment of the property.
So the pass-through business, that was the old house you were talking about?
Yes.
Yeah.
Yes.
You can see that on your existing floor plans.
Right.
David, did you say there's cesspools there now?
Yes. There's my understanding there was cesspools. That's,
Do you know where they are?
no, I don't.
Okay.
You said the former septic was a cesspool?
It's cesspool.
So that's why it was
Cesspool or cesspools, yes.
And then Judy, so officially on the Board of Health data bank, it's a previous house was a 5-bedroom house?
I mean, we don't, it has cesspools, so we have no record of it.
So it means it's officially grandfathered as a 5-bedroom,
Yeah, I mean, it is what
By our
it is,
rules.
so, yeah.
yeah.
Even though it's being torn down?
Yeah, I mean, our policies have always been that they get to keep what they have. That's pretty standard, so. And it's basically an existing 6-bedroom house, and they're only rebuilding it as 4 bedrooms, so that's pretty standard for what we've always approved.
On 6,000 square foot lot?
Yep, they get to
Small
keep
lot.
what they have, as long as they're not going for Title V variances.
Now, those cesspools are going to have to be identified and pumped out and abandoned, correct?
Yeah, we can add a note to the plan that the contractor will identify where they are, pump them, and if they're in the way of the new system or the new foundation, they'll be removed.
Okay. Now, do they normally remove the old cesspools or just backfill them with sand?
We only specify that they be removed if they're within the footprint of the new house or the new septic system.
Okay. Thank you.
There's no requirement to remove them, other than pumping them and making sure that when they're backfilled, they're safe from collapse, future collapse.
Okay.
Dick?
So the policy of the board has been to grant people the ability to rebuild a house up to the size of the existing house. So if this had been an 8-bedroom house, they could have 8 bedrooms on a 6,000 square foot lot with a Title V septic system.
Yep.
Which would be totally outrageous in terms of the size of the lot and the.
Yeah.
And is this written somewhere, or this is just a policy? Because it seems ridiculous to me.
If you read the nitrogen loading regulations, they basically says for new construction, or,
Well, this is new construction.
we don't call it new construction because they're not adding flow. And the definition in Title V of new construction is if you're adding flow. So they're not adding flow, they're actually getting rid of flow on this property. I mean, it's pretty unusual to have a property this small that have that many number of bedrooms. But occasionally, I guess you do see it, but most 6,000 square foot houses are 3, maybe 4 bedrooms at the most. So if they needed different variances here, if they needed Title V variances, and they were adding flow, that would be more, you probably wouldn't want to approve that, but this is something you've always done, so.
It's been the standard in Title V since 1995, what the definition of new construction is.
Yeah, but that's my understanding, that we grandfather it, but we changed the rules so that if you already have more bedrooms than the lots allowed by right, if you put an IA, you don't get an extra bedroom.
Right.
We took that away, so we cut back there. That's one change we made. But he's not, they're going for fewer bedrooms, actually. But in Judy's note to us, it says a pool's going to be on the property? I don't see it on the,
Do I say
is
that?
that? And a pool in the second paragraph.
In the application?
How do they have space for a pool? That doesn't sound right.
You know, we're not, yeah, if that
Oh,
is,
That's
that,
a typo.
yeah,
It's wrong.
Typo.
we're not.
No pool,
There's no
okay.
room for a pool on this
And then,
property.
Well, that whole line is a typo, I'm sorry.
Okay.
and then there's a property between the house and Taylor's Pond Road. Is that another property, or is that a lot, or?
That is owned by another family member, and we just went through the permitting process on that. We're showing it on all the permitting plans because they're sharing a driveway.
Right, so you have some, yeah, the
It's a
driveway's there.
separate lot.
And then I asked the question before, how much weight can you put with cars and trucks on top of a leaching system? Or, in this case, it includes the septic tank. The driveway is over it.
So all the septic components are rated for vehicle loads. So,
Do they put a pound thing on it?
no, well, it's the Caltech chambers, you can either purchase them in what's called H10 or H20 vehicle loading. So H20 refers to Highway Administration rating for structural components or any components that are installed subsurface. And that means that a vehicle with 20,000-pound axle load, so you think of a large box truck or a cement truck, that's 20,000 pounds per axle. And that's what that component can resist with proper backfilling and at least 12 inches of cover material over it.
So,
We've specified H20 components throughout this system.
so you have to specify special components because it's
Yes.
under a driveway to make it take more weight?
Yes.
Okay. All right, and so the septic system and the leaching system, there's no way to put it 100 feet away from the coastal bank, that the property is all less than 100 feet, so that, the question I always ask is, could you improve the position on the lot, and it doesn't look like it. And then, other questions on the board? It says proposed dwelling on an adjacent lot, is that related to this property?
Yeah, that's the lot that's owned by another family member, that these two properties will be developed at the same time. That's why they only need 4 bedrooms on this, because one of the other Rybeck family members are going to build a house with 2 bedrooms on the next property that doesn't require any waivers.
Okay,
So that's how you get to the 6. So they're preserving the
Yeah,
6-bedroom right by apportioning it for
Well,
2.
no, the vacant lot is entitled to 2 bedrooms under your nitrogen loading regulations. So, it's separate from this
Oh, it's not
application.
the same lot?
It's not the same lot.
and it's not part of this proposal, so
No.
it's just a.
Okay.
It's a separate lot.
But
And then in
that's
terms
how the family is basically creating a 6-bedroom compound, so to speak.
Yes.
They thought about keeping the 5 bedrooms, but they really like the idea of having extended family members in a different building, which,
They probably don't get along that well.
And so I was looking at on the architectural drawings, the bedrooms, there's 3 that are named bedrooms, and then there's office study, which is, you're counting that as the 4th bedroom?
yes, because it has a door and it's
It would qualify as a
more
bedroom
than-
by our rules, but, okay,
70 square feet, yeah.
Yeah.
And then there's an additional room down in the basement.
yep.
that-
Okay, other questions or comments from the board? So this will be a 4-bedroom. And the system's located as well as it can be, it looks like. Any comments from the public or online? And can I get a motion to approve if there's no other comments? Or motion?
I'll move to approve that the comments that you used,
Conditions.
the conditions.
In a second,
Second.
Do you want me to
and
read?
Judy can read the.
The applicant should restrict the property to a maximum of 4 bedrooms and record the restriction on the deed at Barnstable County. The applicant shall submit a copy of the executed deed to the board. The engineer shall submit an engineered as-built plan, including as-built elevations, with a written certification that the system has been installed in accordance with the approved plan. No alteration of the floor plan of the dwelling will be allowed without further review by the Board of Health or its agent. And then, that's it.
Okay, and then when I call your name,
Sure, there was no consideration for putting an IA system in because of the size of the lot.
When we first looked at this project, we looked at IA technology and keeping 5 bedrooms. So they decided, because another family member is developing the other lot, they didn't need 5 bedrooms, they certainly didn't need 6. So they felt that the reduction in the number of bedrooms would offset the IA technology.
okay, then when I call your name, Carol Boyce,
Yes.
John Beckley,
Yes.
Ron Broman,
Yes.
Dick Edwards,
Yes.
Noble Hanson, yes. So that variance is granted.
Thank you very much.
Thanks, David.
Okay, next on the agenda is update on rubbish haulers affidavit form for renewals and transfer facility issue with trash hauling, perhaps with the trash from other towns. Judy has an update for us there, I think.
Yeah, I just, you'd asked a couple times about this, and I just wanted to let you know that we met with our IT department last week, and to get all of our renewals out on the OpenGov platform that we use, and we added for the rubbish haulers an affidavit that we had discussed earlier in the year about that they're only allowed to haul from Chatham to our transfer station, Chatham Rubbish. So that's in there, and that's already being used, because we were already getting renewals in. And I also resent in your packet, there's an affidavit that can be used at the transfer station. That will start January 1st. And I sent that to Rob Faley, our DPW director, and I think he's okay with it. We haven't worked out the details, whether it's going to be on the iPad or, how they're going to do it, whether it will be a paper form with copy to them and a copy to us, but that's what we're moving towards for January 1st. So I just wanted to let you know.
How many different haulers will be coming through using this form?
What did we
A
say?
small number, right?
It was a very small,
I think it was
yeah.
eight haulers applied last year.
I had given you that list, a spreadsheet with all the different haulers, and it's a pretty small number that come in there regularly.
I was just
It's pretty
wondering,
much just Millie and
just a handful.
Nickerson, and a few
I think 8 had
local
permits.
cleaners and such who haul, like Delmar Rental Company hauls their own trash. There's a Butler's, trash butler who goes around and does some pickups at people's houses. That's pretty much it. There aren't too many.
Because when I was looking at the usability of the form, the thought crossed my mind having a checkoff box,
Yeah,
having the names of the companies above, and then just to make the guy that's doing it, give him a little less writing to do.
sure, we could do something like that.
And then I was wondering whether the word affidavit should go on the top above
Sure.
the other.
Certification form.
I like the word affidavit better, but I don't know.
So
don't know whether it
this
makes
form would
I
apply
like
to,
affidavit, too.
this form would apply to anybody who's weighing in by the tonnage and bringing?
Right, right.
That's how Mr. Faley would,
Commercial haulers, yep.
right. And so you made up this form and you're giving it to Mr. Faley, but and has he had a discussion with you about instituting this and whether it'll be okay with his personnel and all that kind of
I
thing?
mean, we haven't had a long discussion. He hasn't he hasn't said that he didn't like it at all, so, right from the start, he's.
So this
yeah,
could be
we-
an NCR copy with a white copy, you
Right.
know, and then he leaves with the yellow behind. I mean,
Yeah.
the driver takes the
Yep.
yellow with him. It'll be
I
on a
don't know what
clipboard.
whether they use iPads for weigh-ins and stuff now, so they
Right.
might have something like that as well, so I have
Correct.
to, I just have to work out those details
Right.
with him, but, this is the essence of the form. I can try and do a checkbox with a bunch of different haulers.
And then
Maybe have other, yeah.
Yes.
If there's anybody, occasionally, a resident might have to go over the scale for some reason, that type of thing, if they're bringing in a bunch of stuff or whatever. So, yeah, it should be pretty straightforward.
And so we went over the new application form that Judy put together, and we sort of approved that. So that's, and it has an attestation part to it where they say they're only going to dump trash from Chatham. So that's, and that application thing will be used in December. I think the renewal is January 1st.
Yep.
So that's all set. And then
Well,
this
they're
will be,
renewing now, so,
yeah.
Okay.
so they're using it already.
And then the letter you set out informing them of the changes in our reinforcing the fact that it's only Chatham trash. You have not heard back, have you heard back any
No?
blowback from them or questions or
I sent that
comments?
out,
or-
I said, we're happy to discuss it with you, you're happy to
Right.
come in or
Right.
talk to the board directly. I sent them to everybody on our list and did not hear anything from any of them,
Okay.
so.
Okay, I think that's pretty good. Any other questions or comments or?
Just curious, what's the status of the floor of the waste building? The repairs on the floor?
Oh, the floor.
As far as I know, that's I think it got approved in the budget, at town meeting, so maybe this
think
spring,
that's-
I can find out for sure.
How do they,
That's the next phase, I think.
how
Right,
do they do that work while the building is in actual daily use?
they might have to use like
On Wednesday?
haul-off trucks or something, temporarily for
Temporarily
people to throw their
Yeah.
trash in. Yeah, I'm sure they have a plan for that,
Well, they're closed on Wednesday.
but that's true
Wednesdays.
too.
Then in the next phase, the guardhouse there will be right adjacent to the weighing platform. So when these trucks come in, they'll be right next to that. It'll be more convenient
Oh, is that true?
When they redo
when they
the,
redo it. So it'll actually even get easier for them with the new part.
Okay.
Oh, any questions from the public or comments online or
no?
any other comments or questions about the trash hauling? All right. Okay, then any public comments in general or future agenda items request?
I just have a reminder that Wednesday is the opioid settlement funds listening hearing sessions. They start at 6. You can watch them online, or you can come in person to the community center. There's also, I sent you all a copy of it today. There's also a link with a survey in there that I would love if everybody would fill out. We're trying to get as many citizens in Chatham to fill out the survey. It's a quick
You
survey.
sent us something today by email?
Yes,
Okay.
yep. So, yeah,
I've never heard the phrase listening hearing before. What's a listening hearing?
it's a
Nobody
listening,
can speak?
no. It's just a term for us to listen to them, basically. So they come and we have somebody who's going to facilitate it by asking questions of the public to try and engage some discussion on how we should use the
You want them
funding.
to speak up so you can
Right, so
hear what
we're
they have.
listening to them. We are gonna do, there's a quick PowerPoint at the beginning, kind of explaining the history of the opioid settlement funds and how they are required to be used, and what the requirements of the state that we're held to, how much money we're getting, all of that, which is very interesting and good information, because a lot of people, they don't have any idea what this is all about.
Exactly.
And so that, and we just, listening session is just an idea that we can get people to talk to us, and we're listening, and we're gonna take their comments and and use them as we move forward with our plan.
So
So,
this money, a lot of it came from the Sackler families?
The settlement.
actually, it comes from all over, the distributors, Walgreens, Walmart, CVS, bunch of different pharmaceutical companies, including Sackler. Yeah,
It was a legal settlement.
it was and they're all, there's like different money, some things are still being settled, so the money is still coming in and being distributed. It's going to be coming in for the next 16 years.
Is this a federal settlement or a state?
It's a federal settlement, yeah. The
Then it's divided up.
Chatham signed on with the Attorney General, who signed on with the feds. So it's it's a settlement through the
So
federal.
in general, what are the restrictions on the use of this money?
Has to be used for, there's like 8 categories: harm reduction, education, actual care, use for women, pregnant women, those types of areas. Education, I said that.
Narcan boxes?
That's harm reduction, yeah. So there's specific areas that, and if we want to use something and we're not sure if it fits in, there's all kinds of technical support through the state that we can reach out and say, can we use this money for this or not? And we're also using it so far to, we've been supporting Outer Cape Health Services. They have a recovery coach in town. Once a week, we pay them for that. And we're also using it for, we've granted behavioral health innovations, a group that does education and outreach in the middle school and the high schools. So,
And you get monthly reports or
no, at the end of the year, they give us a little report, and I do have
annual
to,
report?
what?
They give you an annual report?
give
so
us
you
a-
have a sense of,
Yeah, yeah. I mean, they give us a description of how many people they served and such. So we do get that annually. And I just finished it last month, report to the state, how much money we took in for fiscal year. So how much we got in, how much we've used, what we've used it for, what's left right now, and they keep track of it, so.
I just have a quick question. I did get the form that you sent out, the questionnaire. How do you expect, or how should we expect it to get to, and who do we want it to go to fill it out, to get is it just for the board?
I think it's an online, if you clicked on it and you said
So you
send,
can't-
it goes to our consultants.
Okay, no, but I meant if I made a copy and gave it to people,
You can bring that to me, yes. If you
Okay.
want to hand that out, I can provide paper copies or, that definitely, you can bring it to us and we can input that,
okay.
so.
do you have a sense of of how widespread this issue is in terms of impacting residents of Chatham? And whether the trend line is going down, is going up, is pretty level, horizontal? What's the nature
I
of
think we have a lot of elders in town that have issues, not necessarily with opioids, but some alcohol, a lot of alcoholism. We have a lot of people with mental health issues. This money can be used for any substance use disorders.
Okay.
Yeah. And, we haven't had any big issues in town in the last couple of years. My understanding is that deaths from opioid use have declined in the last 5 years, and they feel that has to do with all the harm reduction work that states are doing with the Narcan and the sharps, just, giving out sharps and all that, so.
So Chatham is part of the program by virtue of having voted or decided to throw in with the settlement. But are there towns here that are not participating towns because they were, or did
There
everybody?
may be, I think all the surrounding towns are, pretty much everybody on the Cape joined right in. I mean, it's kind of a no-brainer. You're just putting,
Exactly.
sign on and you're getting hundreds of thousands of dollars to do
Right.
this work, so,
Okay,
yeah.
Okay, thank you.
Who is the "they" then when you say are presenting and
We have a facilitator.
who is from the county or
No,
state?
we hired a
Or
consultant.
you hired a
Yeah.
consultant?
Yeah, so the 5 towns that are involved,
So
and we used our opioid funds for
they
that.
will present the broad thing before the,
Yes.
yeah. And then
I think it's going to be very interesting. I'm
the
hoping.
the
we get good
Narcan
turnout.
boxes that we already have, I think it's 5 or something around town?
Just 3 right now.
3. Do
yeah.
we have any idea how much Narcan is being taken from them?
I don't. I could reach out to the AIDS support group. and
Who
see.
supplies them? Who?
The AIDS support group of Cape Cod. And they have been, we have funded them as well, with some small grants.
Okay.
And what is the title of the person we hired, and what are they trained to do? What are their credentials?
We hired as the recovery coach, or?
Yeah.
I don't know what her credential, she's a person with lived experience, and she's some type of a counselor. I think she's also getting her education completed as well.
Okay.
She's been great. I can't say anything. We've had she participates in our monthly meetings, and
Good.
she's been really good, and she's very much in tune with the community, so.
Okay.
And then how's it being advertised to the community?
The listening
How are you getting the
sessions.
word out?
Well, there was an article in the paper which I sent to you today. It's been posted all over town. It's been going to all the social service agencies. I sent it to all the churches.
Okay.
It's been in the
Article in the
paper. It's
Chronicle?
been in the mainstay. Yeah, I sent you the article from the
okay.
Chronicle. And I was happy with that because I thought they did a good job with it.
Great.
It
Other-
may be, if the money is readily there, it may be useful to develop a display ad of some type to run on a regular basis in, say, the Chronicle, so that everybody that reads the Chronicle is reminded of the existence of the services and the program.
Right,
They kind of keep it in people.
Right.
In
We have
people's-
one more year in our contract with Outer Cape Health, and I'm hoping that in the meantime, we'll form a collaborative with the other towns, and we can keep the program going throughout our communities.
You want to keep it visible
Yeah, yeah,
and aware.
yeah. So, maybe next time I mentioned to you about the Credible Minds platform. We can put that on an agenda, and I can share that with you on the screen and show you that other program that we're doing on the Lower Cape, which is providing mental health, like online mental health information, basically what it is. It's really good, so.
Okay, that sounds great. Any quick update on the property that we started fines on last meeting? Have they been in contact?
She's been finding her and have not heard back from them as yet. So if at some point, we're gonna probably have to, if she doesn't catch on quickly, we're probably gonna have to take them to court or something. Someone's quacking.
Okay,
So
all right.
I didn't get an update today, but Karen has sent like 3 or 4 groups of letters out to them.
We'll find out.
And then we have a whole nother batch for our next meeting, we're waiting to hear how many people are gonna end up coming to the board, so.
What are her fines up to now, do you know?
God, they've gotta be up to a couple $1,000s easily.
It's just bizarre.
It is, isn't it?
And she has the woman's email address and everything, it's been talked to her, so.
She talked to her directly, yeah, so
Yeah.
it's odd.
Since that first conversation, she's.
Yeah, well, no, not since then, not since the meeting, but, no, I don't know. Got me.
Okay, other comments or future agenda items requests? If not, we have minutes from November 3rd. And they actually include Chatham Board of Health regulation, determination of bedroom count, our final thing we put together that will then go to a public hearing. And a note that Greg Berman sent to Jill Goldsmith concerning the 32 Mill Hill cleanup is in those minutes, so there's a lot of good stuff there. Can I get,
I'll make a motion, we approve the draft minutes from November 3rd.
in a second?
Second.
Okay, Carol Boyce, Approved?
Yes, approved.
John Beckley?
Yes?
Ron Broman?
Yes.
Dick Edwards?
Yes.
Noble Hanson, yes. Those minutes are approved. And then, if nothing further, a motion to adjourn?
So move?
Second that.
Okay, Carol Boyce,
Yes.
John Beckley,
Yes?
Ron Broman,
Yes.
Dick Edwards, Noble Hanson, yes. We are adjourned.